If you started Ozempic, Wegovy, Mounjaro, or Zepbound, and you haven't been to the bathroom in days, you're not alone. And you didn't do anything wrong. Constipation is one of the most common side effects we see with GLP-1 medications. Somewhere between 20 and 30% of people taking these medications will experience it at some point. But here's the problem. Most patients are either ignoring it or treating it the wrong way. And when constipation goes unmanaged, it doesn't just make you uncomfortable, it can actually start interfering with your results. Hi, I'm Philip Marks, head nurse practitioner at Regenics in Tarzana, California. I personally oversee more than 350 GLP-1 patient visits every month. And in this video, I'm going to explain exactly why constipation happens, clear up 3 things most people get completely wrong about it, and walk you through the 6-step system we use with patients to fix it. Let's start with what's actually happening inside your body. GLP-1 medications slow gastric emptying. That's not a flaw. It's one of the primary reasons these medications work so well. Food stays in your stomach longer, you stay fuller longer, and naturally, you eat less. But here's what most patients don't realize. That slowing effect doesn't stop at your stomach. Your digestive tract has its own nervous system called the enteric nervous system. Sometimes it's referred to as your body's second brain. It controls the contractions that move food and waste through your digestive tract, and it's packed with GLP-1 receptors. When these medications activate those receptors, the entire system slows down, not just your stomach, your small intestine, your colon, everything. And that's where constipation starts. The colon's job is to absorb water from waste as it moves through your body. Under normal conditions, transit is fast enough that stool stays relatively soft and easy to pass. But when transit slows down, waste sits in the colon longer. The longer it sits, the more water gets absorbed. The stool becomes harder, and harder stool becomes more difficult to pass. Then add one more thing. Most patients on GLP-1 medications are eating significantly less food than they were before starting treatment. Less food means less bulk moving through the digestive tract and less natural stimulation for the gut to keep things moving. So now you have the perfect setup: a slower gut, harder stool, and less bulk moving through the system. That's the mechanism. And stay with me, because magnesium is not actually the first thing I recommend. In fact, most people skip the 2 steps that make the biggest difference and jump straight to supplements. Before we go further, I want to clear something up. Not every change in bathroom habits is constipation. If you used to go every day and now you're going every other day, but it's comfortable and there's no straining, that may simply be your new normal. Less in means less out. That's basic physiology, not necessarily a problem. What we're talking about today is fewer than 3 bowel movements per week, hard or difficult to pass stool, straining, feeling like you're not fully emptying, persistent bloating, or ongoing abdominal discomfort. And I want to be very clear about something. If you're experiencing severe abdominal pain, persistent vomiting, or you haven't passed stool in more than a week, that needs a medical evaluation. That's no longer something I want you to try and solve at home. Now let's talk about the 3 biggest misconceptions I see. The first is, it'll go away on its own. Sometimes it does. For some patients, constipation is worse during the first few weeks and improves as the body adapts. But for many patients, especially as doses increase, it either stays the same or gets worse. I've seen patients stop a medication that was otherwise working extremely well because nobody explained how to manage the constipation. And that's unfortunate, because in most cases, we can manage the constipation without stopping the medication at all. The second misconception is, I just need more water. Water matters. In fact, it's step number 1, but water alone usually isn't enough. The core issue is gut motility. The contractions that move waste through your digestive tract have slowed down. Water helps soften stool. It doesn't restore gut movement. You need a more complete approach. The third misconception is, I'll just take a laxative. Be careful here. Stimulant laxatives like Senna or Bisacodyl can provide short-term relief, but regular use can create dependency. Your digestive system starts relying on the medication to move rather than doing the work itself. There are much gentler and more appropriate first-line options, and that's exactly where we're headed next. Let's walk through the 6-step protocol we use most often with patients. Step 1 is hydration. This is the foundation. GLP GLP-1 medications reduce appetite and thirst at the same time. As a result, many patients become mildly dehydrated without realizing it. My general recommendation is to drink at least 2 liters of water per day, and more if you're exercising regularly, spending time outdoors, or living in a warmer climate. The easiest strategy is to keep a large water bottle nearby and finish it twice throughout the day. Hydration by itself usually isn't enough to fix the constipation, but it's the foundation. If you're dehydrated, everything else becomes harder. Step 2 is fiber, but done correctly. This is where many patients accidentally make things worse. They hear fiber is important, immediately double their intake, and end up more bloated than before. Then they decide fiber doesn't work. The issue isn't fiber, it's how quickly they increased it. There are 2 main types. Soluble fiber is found in foods like oats, chia seeds, flax seeds, apples, and beans. It absorbs water and helps soften stool. Then there's insoluble fiber, which is found in vegetables, whole grains, and many plant foods. This adds bulk and helps speed up transit. You need both. Just increase them gradually. Most women should aim for roughly 25 to 35 grams of fiber per day. And honestly, most patients I see are getting about half that. If you're using a supplement, psyllium husk is usually my first recommendation because it provides soluble fiber and tends to be well tolerated when introduced gradually. Step 3 is walking after meals. This one is consistently underestimated. Movement directly stimulates gut motility, which is the exact thing GLP-1 medications have slowed down. One of the simplest and most effective things you can do is take a 10 to 15-minute walk immediately after meals. Not a workout, not cardio, just a walk. Multiple studies have shown this helps support digestion and improve blood sugar control. This isn't a lifestyle tip, it's a digestive intervention. Step 4 is magnesium. This is probably the recommendation I give most often for GLP-1 constipation, specifically magnesium citrate. Magnesium citrate works by drawing water into the intestines while supporting gentle contractions of the digestive tract. It's not a harsh stimulant. It works with your body's natural processes rather than overriding them. Many patients are also mildly deficient in magnesium before they ever start a GLP-1, so there can be additional benefits as well, including better sleep, reduced muscle cramping, and improved recovery. A common starting point is around 300 to 400 milligrams taken in the evening. But if you have kidney disease or any kidney-related problems, speak with your provider first before starting magnesium. Step 5 is an osmotic laxative. If you've been consistent with the first 4 steps, for 1 or 2 weeks, and you're still struggling, this is usually where I tell patients to go next. Polyethylene glycol, better known as Miralax, is considered the gold standard first-line recommendation by most gastroenterologists. It works by pulling water into the bowel. This softens stool and makes bowel movements easier without creating dependency. It's tasteless, mixes easily into liquids, and is generally very safe along GLP-1 medications. This is a significantly better place to start than reaching for stimulant laxatives. Step 6 is clinical evaluation. If you've worked through the first 5 steps consistently and constipation remains a problem, it's time to speak with your provider. Sometimes dosage adjustments help. Sometimes timing adjustments help. And sometimes patients notice constipation gets significantly worse with each dose increase. Those situations need a proactive strategy. Don't wait until you're miserable. If your digestion isn't improving, reach out early. There's one final point I want patients to understand. Constipation is not just a comfort issue. It's a results issue. When you're bloated and uncomfortable, you naturally start eating less, not just fewer calories, less protein, less hydration, less nutrition overall. And that's where we start seeing problems. Energy drops, strength drops, recovery slows down, and your risk of muscle loss goes up. And that's especially important on a GLP-1 medication because preserving muscle while losing body fat is one of the biggest predictors of long-term success. I don't view constipation as simply being uncomfortable. I view it as a performance issue and a results issue. Constipation on Ozempic, Wegovy, Mounjaro, or Zepbound is common. It's physiological, and it's not something you have to accept as the price of your treatment. Remember the 6 steps: hydration, fiber introduced gradually, walking after meals, magnesium, osmotic laxatives if needed, and clinical support if it's not improving. Don't wait until you're miserable before addressing it. The earlier you support your digestion, the easier it is to stay consistent with your treatment. Work through these steps in order, and most patients see meaningful improvement within 1 to 2 weeks. And if you're dealing with other side effects from your GLP-1 medication that nobody warned you about, watch this next video. We break down what's normal, what's not, and when it's actually time to call your provider. I'm Philip Marks, head nurse practitioner at Regenics. Thanks for watching, and I'll see you in the next video.